Welcome to the first lecture of Module 4. This module has 4 lectures and lasts 3 weeks. And this lecture will cover early motor development, and most of the material in this lecture is from Chapter 6 in your textbook. Quick lecture outline, we'll be going over the APGAR test, some basics on early motor development, covering the motor milestones, phylogenetic versus ontogenetic milestones, spontaneous movements, the function and characteristic of spontaneous movements, reflexes and postural reactions. So to start, we'll watch this video about the APGAR test.
For the APGAR, the newborn is given a score from 0 to 2 in each of 5 categories: heart rate, respiratory effort, muscle tone, reflex irritability, and skin color. The assessment is completed at 1 minute and repeated at 5 minutes following birth. The nurse auscultates the apical pulse to determine heart rate. If the rate is above 100 per minute, the infant receives a score of 2. If less than 100, a score of 1, and 0 if there is no heart rate. Respiratory effort is assessed by observing and auscultating the chest. A score of 2 is given if the infant is crying vigorously, or if the respirations are spontaneous and regular. 1 if the effort is weak or irregular, and 0 if there is no effort. The muscle tone of a full-term infant is judged by the amount of flexion. Well-flexed extremities receive a score of 2. Some flexion, a score of 1, and if the infant is flaccid, the score is 0. The nurse evaluates reflex irritability by gently slapping the sole of the infant's foot or by inserting a catheter in the newborn's nose. A responding cry receives a score of 2. A grimace receives a score of 1, and no response is scored 0. Color is the 5th component, and the infant must be assessed for both central and peripheral cyanosis. If the Caucasian infant is completely pink, indicating oxygenated blood, the score is 2. The score is reduced to 1 if the hands and feet are bluish. If the infant is pale or if the body or face is blue, the score is 0. Because non-Caucasian infants may appear ashen gray, the mucous membranes of the lips, mouth, and tongue should be observed for central cyanosis. The scores for all 5 components are then totaled. A score of 8, 9, or 10 indicates satisfactory cardiopulmonary adaptation and requires no specific intervention. Scores between 5 and 7 indicate the need for stimulation and the administration of oxygen via bag and face mask. Resuscitation may be required if the score is below 4.
Cool. So that video is very informative about the APGAR score, but just to kind of go over what it is again and when it's administered. It is administered 1 and 5 minutes after birth, and the 5 items are scored so the infant can receive a score between 0 and 10. Scores 3 and below are critically low, 4 to 6 fairly low, and 7 to 10 is considered fairly normal. Infants with lower APGAR scores are considered at risk for neurodevelopmental disorders. So like mentioned in the video, we're looking at appearance, pulse, facial movements, muscle tone, and breathing movements. And you see here how it is scored. So after the first minutes of life, motor milestones are used to assess motor development rather than just an APGAR score or a simple test like that. The motor milestones are fundamental motor skills whose attainment is associated with the acquisition of later voluntary movements. The order in which an infant attains these milestones is relatively consistent, although there is some variability in regards to the timing of the attainment of these milestones. These motor milestones are significant for a couple of reasons. There are 2 primary categories of motor behavior that we see throughout the process of development, and they are phylogenetic and ontogenetic behaviors. Phylogenetic behaviors are those that occur with the development of the species and are considered resistant to environmental influences. Examples of this include reaching and walking. Ontogenetic behaviors are not general to the species as a whole, but emerge as part of learning and the environment. These include skills such as piano playing or ice skating or other motor skills that are learned. So knowing that there are two primary types of motor behavior that we see in development, how do we assess motor milestones? We use norm references and criterion references. So we use norm references that reflect the test age performance of a large representative sample of infants. We compare the motor behavior that infants are displaying to these age reference norms. The advantage is that we can identify slowly developing children. The disadvantage is that there's no information to determine why the differences exist and what we should do to help the slowly developing infant catch up. We can also use criteria-referenced scales that determine whether an infant has achieved some pre-established standard of performance and provide information on the infant's specific capabilities in a given task. Norm and criterion reference scales are not mutually exclusive, and many norm references tests can also be used as criterion reference tests. The task can be performed in relation to a representative sample, or it can be measuring a specific task, or both. So this table outlines the developmental trajectory that is outlined by the Bailey's and the Shirley scales. While the milestones are different for the two scales, you can see that they do line up for the most part and have overlapping regions. For example, the sits with support ranges from 1 to 5 months and is at 2.3 on the Bailey scale. The same milestone is 4 months on the Shirley scale, which falls within that range. The scales continue on this slide. Be sure to look at these and be sure to generally know the age ranges of some of the general milestones. For example, stands alone or walks. You don't really need to know walks backwards and things like that. That's not really that important, but if you go back up to this slide, you want to know when the infant is able to sit with support. So what happens before the onset of motor milestones? Do infants move? And if yes, what are these patterns of movement? The movements that occur before the onset of controlled voluntary movements are called stereotypic movements, and they occur without any stimulation. They are defined as movements of parts of the body or the whole body that are repeated in the same form at regular short intervals of about a second or less, and may include various forms of kicking, arm waving, banging, bouncing, rocking, twirling, scratching, and swaying. Essentially, those are the movements that you see that children do that look fairly uncontrolled. The actual function of spontaneous movements is still relatively unknown, but there are a few explanations for it. From a maturational perspective, spontaneous movements may be the result of the nervous system development. They also may be compensatory movements, as the infant's nervous system is not yet fully developed. When the infant is presented with too much stimuli, he or she may perform these spontaneous movements to compensate for the fact that the nervous system cannot yet process the environmental stimuli. They can also be seen as a primitive form of goal-directed movement or motor babbling. So when you see a child first learning how to talk, you hear them just babbling blah blah blah, like da da. It's kind of thought of as the spontaneous movements being the equivalent of the weird sounds that children make when they're learning to talk. We'll pause our lecture here and we'll continue talking about spontaneous movements in the second part of this lecture.